Hi y'all, it's Joan Keel, nurse practitioner here at Florida Center for Hormones and Wellness. I've met many of you, some I may not have met yet, but I look forward to meeting you if I haven't. This is just a brief overview of what is insulin. I know that you've probably been here for a while and things are going well, but maybe you feel like you're not quite getting all the results you need. Well, there's one other hormone that sometimes we miss talking about, or it's so much in the beginning that we don't talk about it and want to pick it up and address it later in your time with us. And that would be insulin. Insulin is a very important hormone. So the quick overview is what is insulin. Insulin, as I stated, is a very necessary hormone in order to transport sugar from our food sources of carbohydrates and into the cells for energy, for metabolism. When we become insulin resistant, it's because over the course of time, we have consumed too much beautiful, wonderful sugar and have created such an overabundance of insulin that eventually the cells become desensitized. So then it takes more and more insulin in order to push that sugar into the cells for energy. And as I've shared with some of you that have may been in my office, if the sugar can't be used for energy because the cells have shut down receiving insulin, then they get converted and stored as fat, or converted and taken up by the liver. That sugar taken up by the liver during the day gets dumped by the liver at night. Hence, when you know people who are diabetic who talk about horrible morning blood glucose levels and horrible morning insulin levels, it's because they've dumped all that sugar. Well, we can be insulin resistant and not be diabetic. In fact, insulin resistance is the first phase going towards pre-diabetes. You can be very thin and still be insulin resistant. So sometimes size and volume is not necessarily an indication of health. That stated, one of the things that we'd like for you to consider is how much sugar we're consuming. It's called life, and we're not ever going to be perfect, and we can't go our entire life and not have some sugar. But we have to understand that every carbohydrate, regardless of whether it's simple or complex, is sugar. And every sugar molecule requires an insulin molecule to attach to it in order to be processed and utilized. It's when we have that overabundance of sugar going into our system, and then therefore an overabundance of insulin over time, that creates this barrier that does not allow us to metabolize our sugar appropriately and causes us to often gain weight, and or if we're not heavy, to be sluggish, to be tired, to be inflamed, to have joint pain, to have lack of clarity of thought, even though the rest of our hormones present to be in good balance. So I would encourage you to let us take a look at your insulin levels if we haven't already. And those of you who I've already been working with, we are well on our way. And just know that with insulin resistance, it is not diabetes. Not every insulin resistant person will become diabetic. But just know that all diabetics were insulin resistant before they became a diabetic. Our goal is to prevent that. Again, most of the things that we deal with as adults when we get over the age of 35, 40 is age-related diseases due to a loss of hormones. That stated, if you haven't had your insulin levels checked, come see us. We look at 9 different labs to make this determination. Pre-diabetes is easier. It's simply a matter of doing a hemoglobin A1C and a glucose level. But before you ever get to that point, I want to look at your C-reactive protein. We want to look at your homocysteine. We want to check your lipids. We want to check your glucose. We want to check a multitude of your insulin fasting level and a multitude of some other labs to come up with a complete picture of just how insulin resistant you may be. And then there are ways that we can mitigate, reverse, and then therefore get rid of insulin resistance. So then when the holidays do come and we have that piece of pumpkin pie, we don't have to worry about gaining the weight, or we don't have to worry about feeling tired, exhausted, and fatigued afterwards. Appreciate your time. Look forward to seeing you in the office. Come meet me and my sugar out at my desk, and we'll be glad to take care of you. Take care. Bye.